Hello, everyone, and welcome to another enriching episode of MedSynapse podcast series. I'm your host, Hedvi Shah, and today we are delving into an often overlooked yet critical aspect of healthcare, which is emotional intelligence amongst doctors. In a profession where decisions can mean life or death, and every interaction impacts someone's well being, emotional intelligence can be a game changer for doctors, not only in improving patient outcomes but also in fostering cohesive teamwork and managing personal resilience. Joining us today is someone whose expertise in health management and passion for health makes her the perfect guide on this topic. Dr. Shwet. Dr. Shuet is the head of quality unit at Penang State Hospital and a senior medical administrator recognized by the Malaysian Ministry of Health. With over 17 years of experience across London and Penang, he has carved a niche in public health and health management. A fellow of the Royal Society of Public Health in the UK and an accomplished researcher with multiple international publications. Dr. Shwed's insights into emotional intelligence, coupled with her experience in hospital management, will undoubtedly inspire and inform us today. So, welcome, Doctor, and it is an honor to have you here today.
Thank you so much, Miss Hedvisha.
Now, let's start with the basics, Doctor. So, could you explain what emotional intelligence is and why is it so crucial for doctors, especially how does it, foster better doctor-patient relationships and effective teamwork among medical staff?
Okay, so basically, when we talk about emotional intelligence, we have to go back to the start. So, in the beginning, according to Gardner in 1983, what we have is multiple intelligences, which consist of seven types of intelligences: linguistic, logical, mathematical, musical, bodily kinesthetics, spatial, intrapersonal, and interpersonal intelligence. So, these are the different sorts of intelligence, and the two intelligences that are intrapersonal and interpersonal intelligences are the ones that are most um, linked to emotional intelligence. So, interpersonal intelligence is the capability to discern the desires, feelings, and motivations of other people, and intrapersonal intelligence is the understanding of oneself. So, emotional intelligence is described as a constellation of emotional perceptions, which are the trait emotional intelligence, or a set of skills to process emotionally related information. So, in alternative terms, what it is it refers to the ability of the individuals to make a link between the emotions that they feel and come up with reasonings which enable them to guide their actions and, as a loop effect, use the reasonings to guide their emotions. So there are three models of emotional intelligence which have been introduced. So these are the ability-based model, the traits model, and the mixed method model. So what the ability-based model is, it applies greater parameters around the constructs, and this includes narrower definition which excludes personality characteristics. So it refers to intellectual processing and mental aptitude, and mental abilities cannot be divorced from intellect. And what is an ability and a type of intelligence. So it involves appraisal and expression of emotions, regulations of emotions, and utilizations of emotions. Trait model is based on the method which utilizes self-report items to measure overall emotional intelligence. So trait emotional intelligence measures typical behavior rather than maximum performance, and thus has better grasp of actual behaviors in a range of situations. And the concept is based on the individual perception about an individual's abilities to perceive, understand, regulate, and use emotions to adapt to the environment and enhance well-being.
Yes.
So the mixed methods models follows a more emotional approach and focus on personality characteristics. And through Goleman's study within the fields of psychology and neuroscience, he described emotional intelligence as a set of traits which culminated into an individual's character. So these are the three types of emotional intelligences, but we can further categorize them based on Daniel Goleman's what do you call it? A model of emotional intelligence. which were came up with in 1998. So if we can divide emotional intelligence into four different quadrants, each of it is a self-awareness, self-management, social awareness, and relationship management. And in self-awareness, there's emotional self-awareness, accurate self-assessment, and self-confidence. In self-management, there's emotional self-control, transparency, adaptability, achievement, initiative, and optimism. In social awareness, there's empathy, organizational awareness, and service. And in relationship management, there's influence, inspirational leadership, developing others, change catalyst, building bonds, conflict management, and teamwork and collaboration. So, what this encompasses is it starts with self awareness, being aware of your own emotional intelligence, and then we develop all this into a relationship management where it depends on the relationship with others and how you see um, that how you translate that self awareness into a relationship with others. So, as your question, what are the why is it important in
Important.
for doctors? Is that what
Mhm.
you're asking? Okay.
Yes.
So emotional intelligence has been recognized in recency as a highly associated with impact on organization, human interactions, and relations, and it is recognized as important as as intelligence quotient in navigating effective response to the challenges in life. So the perception, management, and utilization of emotional intelligence skills is deemed necessary in predicting the success of a doctor's career. So what we have done, studies have shown that average emotional intelligence of doctors hover around 120 according to the Scoot self-report emotional intelligence test. And this is somewhat an average score of emotional intelligence. And it's noted that this emotional intelligence score is lower than that depicted by the nursing faction and that of radiation therapies. So a doctor's career is constantly filled with stressful situations, and this is more so evident in the career of resident in training. And these residents work long hours, are constantly under immense academic pressure, and have the lives of others dependable on them as they work through their training. So, as it is noted, the emotional intelligence among doctors is lower than other healthcare workers, and thus the interventions that are studied to improve the emotional intelligence among doctors and the introduction of work work hour restrictions for residents has revealed a positive impact on the emotional intelligence with an increase in self-perceived wellness, reduction in burnout, fatigue, and physiological distress. And we
Yeah.
have studies yes, we have studies in the USA that shows that emotional intelligence of postgraduate year two tends to be lower than the postgraduate year one, suggesting that there is not much of emotional intelligence training in medical curriculum. And there's a positive linear relationship between emotional intelligence and training, but it was not observed in this cohort. So the differences of emotional intelligence scores were found not to be significant, but in the postgraduate year three and year two, it was found to be significant, whereby the postgraduate year three has got a higher emotional intelligence than the postgraduate year two. So it's noted that in the second year emergency medicine, resident was expected to evaluate a larger volume of patients in order to obtain a higher level of medical knowledge. And then, together with caring of critically ill patients, um, this makes the emotional intelligence among the postgraduate year two to be lower. So, based on the findings of literature, it's noted that doctors in training may be struggling with self expression and self perception. And you have to consider the lack of emotionally related training in the medical curriculum as depicted by the literature. And you have to weigh in and take into account while some supervising physicians might nurture an environment which supports debate and discussion, there are others that might opt for a less supportive environment.
I think that is such a powerful of perspective that you've given me, doctor. And also, it really emphasizes how emotional intelligence is not just about being, kind, but being strategically empathetic to enhance care in general also. So now, doctors face immense pressure in their daily practice. So what are some of the common challenges that impact their emotional intelligence, and how does it affect decision making and patient care, particularly in high stress situations?
Um, so yes, So, from the studies conducted worldwide, there seems to be an emphasis on emotional and intelligence and its association with job satisfaction, ability to deal with stress, and job performance. As such, there's an association between poor emotional intelligence among doctors and stress in workplace. So, emotional intelligence thus has been factored out as one of the interventions to improve in order to deal with these stresses that doctors have to go through. However, there's yet an undetermined emotional intelligence amongst doctors in many countries, and I can say so in Malaysia as well. But I did a large scale nationwide study last year, which looked at the emotional intelligence amongst doctors in the government Ministry of Health hospitals. So, in that study, it's shown that the emotional intelligence amongst doctors are considered quite well compared to other countries such as USA and India. So there must be something that is being done correctly, and it's shown that the training that we have in the Ministry of Health hospitals are somewhat emotionally intelligent uh, towards that side, and it enhances their emotional intelligence in the long run.
Okay, so it's actually so eye-opening to hear about those challenges as well. And on that same note, I had another question. Like, when you mentioned about the Ministry of Health, is it like there is some particular difference that is happening so that the study showed such high numbers?
Yes. So that study, we investigated the role of organizational culture. We investigated the role of cultural awareness and cultural competence, and we investigated spiritual intelligence among the doctors as well. So it is shown that organizational culture, which consists of clan culture and autocracy culture, has got higher rates of uh, good emotional intelligence among the doctors. These are the flexible cultures where there's a friendly working place, um, and where the leaders act like father figures, and autocracy culture where it is a dynamic workplace with leaders that stimulate innovation. So these are the flexible cultures show that there's a higher emotional intelligence amongst its doctors and employees. Hence, by changing the organizational culture, you'll be able to change the staff emotional intelligence. Similarly, in an environment where cultural awareness and cultural competence are high, the emotional intelligence is higher. So, other than that, the multiple studies amongst healthcare workers also show that higher spiritual intelligence leads to higher emotional intelligence. So, it's not just self awareness and actual training in emotional intelligence which managed to increase the doctor's emotional intelligence, but changing the organizational culture, incorporating an understanding culture, and encouraging spirituality amongst the staff will also increase the staff emotional and intelligence in return.
Yeah, I think that is something every organization also should look upon and learn from them as well. So now, on the same note, can you share some examples from your experience where emotional intelligence led to better patient outcomes or even improved team communication in a high stress medical environment?
So
Yeah.
one thing to note is that emotional intelligence can be taught. Yes. So emotional intelligence can be taught. Hence, from the changes in the leaders that we must see foremost, that is how we can change the emotional intelligence of an organization uh, by changing the leadership qualities in the leaders. So, an organization that is economically, cognitively high has a higher emotional intelligence. The staff can navigate burnout and stress with a better method than when a physician deals with everything according to the old power. There is organizations which work based on who is the boss instead of who is the leader. So here we focus on leadership quality as this has time and time again associated with strong emotional intelligence among the leaders. And let's put it this way, in the context of medical education and hospital management, one who survives in this world of stress are those who are bound to have higher emotional intelligence. The doctors have to navigate interactions with patients, with other senior doctors in the hierarchy, with junior doctors who are likely to complain if you are not doing enough for them, and with multidisciplinary staff. And we can't go around having a go at everyone who think when we think that they are doing wrong. We need to understand where they are coming from, and they might be overwhelmed by workload, by stress, and just like the doctors and experiencing burnout. Hence, it is imperative that healthcare organizations bring in trainers to train staff on emotional intelligence. Let everyone go for it. Doctors, nurses, allied health professionals, medical assistants, the hospital will be a better place for the patients and the doctors alike, with more doctors with higher emotional intelligence.
Yeah, it is so inspiring to see how actually emotional intelligence can transform not just the outcome but even the entire healthcare experience, especially for the doctors. Now, burnout and mental health challenges are prevalent among doctors. So, how can emotional intelligence help in managing these issues? And what strategies or training methods would you recommend for doctors to develop this skill?
Okay. So can I give an example?
Sure.
Okay. So let's say if example a doctor has an encounter with the palliative patient, and to me this is a personal encounter which I have seen. So it happened to a healthcare worker where she was diagnosed with colorectal cancer, and she is now in stage 4. She went for chemotherapy, but chemotherapy proved too heavy for her. She improved on chemotherapy, but when she felt a bit more well, she wanted to stop her chemotherapy and just take herbal medicine, which people claimed could wipe out the cancer she had. And we all know that this is just a hoax, and she paid a hefty sum for the herbal medicine. Let's pause for a while and think. If her doctor had been the paternalistic doctor, he would tell her that she is stupid and she should continue with the chemo. But the doctor did not. He took time to understand where she was coming from, and that the chemo had really made her feel very bad, and she had suffered some multi organ dysfunction which resolved after stopping the chemo. But as a doctor, the oncologist needs to make her feel heard, understand that she suffered from chemotherapy side effects, and educate her that she felt better because the chemo was working. But stopping it would mean that she is closer to death. So, but understand where she is coming from. Tell her that he will respect her wishes, but she should not be so hasty and has to think about what she wants to do. So, in this form of highly stressful decision making situation and persuasion, this is when the emotional intelligence of the doctor makes a difference. So, if the doctor could put himself in her shoes and talk to her like she wants to be talked to, then it differentiates an excellent doctor from a good doctor.
Yeah, I think it is such a practical example as well, and it actually feels very actionable and gives hopes for many like managing burnout is like a sustainable way. So thank you for sharing that. Now, how can healthcare institutions integrate emotional intelligence training into their professional development programs to ensure it becomes a core competency for their staff?
Okay, so you can do this in two ways. So, one way is to teach the emotional intelligence to the healthcare workers. You sit them down and you explain to them what is emotional intelligence. And you tell them that they have to be self aware about their emotional intelligence. Um, you talk to them about what are the components of emotional intelligence, and then you do a pre-test, and then you teach them about the emotional intelligence that they should have, how they should react to others, and then you do a post-test. And then if these people actually improve on the post-test, then you could say that you have actually improved their emotional intelligence. And the second way is to actually um, uh, encourage a different organizational culture, encourage spiritual intelligence, and encourage cultural awareness and cultural competence in the organization itself. So these are other ways that you can uh, target um, emotional intelligence other than teaching the emotional intelligence in this staff, because has been shown that improved organizational culture, cultural awareness, and cultural competence, and spiritual intelligence has led to an increase in emotional intelligence.
Yeah, I think that is rightly mentioned, and I think institutional support plays such a pivotal role altogether while actually supporting for emotional intelligence. Now, Doctor, one last question from my end would be what advice would you offer to young doctors striving to balance clinical expertise with emotional intelligence?
Okay, so one thing about emotional intelligence is it can be gained with experience. So for the new doctors, do not be too hasty to achieve successes, because successes in the life of a doctor doesn't roll down, doesn't come easy. So what you need to do is you need to have experience. You need to communicate with your senior doctors. You need to communicate with your junior doctors. You need to communicate with your nurses, your radiologists, and with your patients. Most importantly, and be able to put yourself in the shoes of all these people and see where they are coming from. And then, other than that, you could also take extra courses, leadership courses, which would teach about emotional intelligence among leaders. So these are some of the methods that a junior doctor can do to enhance their emotional intelligence. And with time, as they climb towards the ladder, they would gain experience and they will be able to increase their emotional intelligence.
I agree to it. I think communication is very important when it comes to
Yes.
emotional intelligence. So communicating the right type of communication is also important. So every doctor should keep that in mind. So now as we wrap up today's session, thank you so much, Dr. Shwet, for sharing your expertise and inspiring stories with us today. Your insights into emotional intelligence are not only practical but also deeply thought provoking. So thank you so much for sharing that, Doctor.
Thank you. You're welcome.
And to our listeners, I hope you found this conversation as enlightening as I did. And remember that emotional intelligence is a skill that can elevate the practice of medicine to new heights. And today's discussion reminds us of its importance in fostering empathy, resilience, and excellence. So, thank you so much for joining us today. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So, until next time, stay curious, stay compassionate, and keep learning.